respected dignitaries, dear ladies and gentlemen, and my dear friends. First of all, let me extend my heartfelt thanks to the organizers of this program for having invited me to share my thoughts upon cervical spondylosis Ayurvedic perspective. I am thankful to Dr. Ramesh Warrior for giving much of the details, elaborate details on what exactly is meant by cervical spondylosis in modern perspective. I'll rather concentrate my talk on Ayurvedic perspective, but first of all I want to rather define Ayurveda. Means is a separate nomenclature necessary for dealing with cervical spondylosis, not alone with cervical spondylosis but with most of the diseases which we know of nowadays, lumbar spondylosis, radiculopathy, etc. Is there a separate nomenclature necessary? Why not we consider it as an Ayurvedic term? Because previously, when our texts were written, cervical spondylosis was not mentioned, and it's relatively a new. Not only the term is new, but the disease itself is relatively new. At that time, I think, to my personal opinion, that cervical spondylosis was very, very rare. Taking into consideration the various nomenclature mentioned in Ayurveda like Abhagavaka, Vishwaji, etc., which Dr. Ramesh has rightly pointed out, we cannot consider most of such diseases hand in glove relation with cervical spondylosis. Of course, certain areas of cervical spondylosis may be mimicking with Ayurvedic terminology. So why not we consider cervical spondylosis as such together and then understand the condition better and then manage it better. In our text it is mentioned, we also know that Egam Shastra Madhiyano Navidya Shastra Nashayam Tasmad Bahushradha Shastra Vijayaniya Chigilsaga. As a clinician, we have to respect all the sciences, we have to gain knowledge in almost all the sciences, then only our treatment would be successful. And just giving nomenclature to a particular disease is not that much important. Vigaranamo Ashishana na Jifriyat Kadajana Nahi Sarvam Sarvavigaranam Namatavasti Nirvasturi. And Ayurveda, we all know, is highly flexible and highly adaptable to any age. The principles are flexible to any era. We all know that the texts in Ayurveda were written somewhere in the BCs and the early ADs. Even now they are adaptable to any living conditions, any community and to any civilization. Even conditions yet to evolve can be understood and managed by Ayurveda. This is unique to Ayurveda and maybe to a lesser extent homeopathic and other sciences as well, but not to modern science. First of all, you have to understand, first of all you have to just envisage whether cervical spondylosis is a condition or a disease. Isn't cervical spondylosis a condition of a pathological process? For example, Astithaduksha. I am telling just an example. It is not, I am telling that cervical spondylosis is not Astithaduksha only. But Astithaduksha definitely plays a role in that. That's all. Ayurveda, in Ayurveda, disease is defined as Rujandi Idirogaha. Rujandi Sharira Manaha Chevi. That mana component should also be there. Sharira Manaso Abhatagara Ityarthaha. Vishishta Lakshana Samashti Bodhaha. Tapta Lakshana Samashtadaya Bodhida Abhyandara Vidharambara Eva Paramartha Yogaha. Disease is not that which hurts you. Disease is the undercurrent of a pathological process which is manifests as a group of symptomatology. And cervical spondylosis, mind you, has not got a solid cause, a definite course, a symptomatology, a development, a purpose or a termination. It is varied. So that I think that cervical spondylosis can be better understood as a condition than a disease per se. Not narrated with much importance, we all know, as I already rightly told. Or is it that it was not considered a serious condition? Even at that period, cervical spondylosis might be there, but when coming to the, when narrating the world diseases, cervical spondylosis has found only a small place. But now, which is more prevalent, thanks to the sedentary work, the minimal exposure to sun. Minimal exposure to sun means We all know that many of us, professionals rather, are little exposed to sun. We are going in cars, then we are stepping out from it to our office cabin, then again we are, as a teacher I am taking class, then again I am coming to my consultation room, doing surgical procedure, being basically a specialty discipline, I am doing surgical procedures. So I am not much exposed to the sun. And many of us are not exposed to sun, mind you. So what happens? Vitamin D3 is not properly formed, and body erosive changes occur when you are some 50, 55, 60 years of age. So conditions like cervical spondylosis are much rampant today because of so many factors, and one thing is minimal exposure to sun, then the nature of work we do, as Dr. Ramesh has rightly pointed out. Many of us are, the little spare time which we get, we are beside the computer as a commentator of Ashtanga Yoga and so many other works. I am always with the computer. If I am getting some little time, I am beside the computer doing some work. So my neck is almost attuned to it with minimal exertion and exercise. Then travel modalities, sitting in non-ergonomic environments, air conditioning, and very rare involvement in manual work, what we call manual. The current understanding of cervical spondylosis is as a chronic recurrent degenerative problem. It is chronic, it is recurrent, it is degenerative of the cervical spine, with occasional bouts of inflammatory changes that I am doing more, I am emphasizing it more, the inflammatory changes. The presentations may be pain, ache, stiffness, particularly due to ama and kapha, and or numbness with a burning feel. The numbness may be attributed to the neurological factors, and the burning can be attributed to the vascular factors, which also play a great role in the making of cervical spondylosis. Here, cervical spondylosis, we know, it is a composite problem. I will come to that point. It's a composite problem. It is not the problem of the disc alone, it is not the problem of the bone alone, but the bone and discs are also involved. See, Dr. Ramesh has already pointed out to the disc lesions, of which I am not going into the detail. Spur formation occur here, and it is this spur formation which we call spondylosis, otherwise it is spondylitis. So there is a gulf of difference between spondylitis and spondylosis, but many a time this all these are together, both the conditions coexist. So that spondylotic element will be there and spondylitic element is there, and your treatment should be judged accordingly. Itic element we are treating or otic element we are treating, spondylotic element or spondylitic element. This is the anatomy of the cervical spine. All of you would know. There are the facet joints, and there are the coming from the dental process to the vertebral body to the intervertebral discs. All these are narrated here. The spinous process, the alignment of which we have to look specifically in a normal cervical spine. There is a lordosis, and this is an X-ray showing the normal disc spaces and the sclerotic edges of the vertebrae after it has gone through a pathological change of the due to cervical spondylosis. And many times it is related to aging. It's a common condition that seldom causes clinical signs. Very rarely it causes clinical signs, but when it causes clinical signs, we can call it a disease. Disc degeneration. Here, in the left side you can see a normal spine and normal structures, and in the right side you can see the degenerated condition. In the degenerated condition, you can see the osteophytes pressing upon two structures. One is the spinal cord per se, another is the nerve roots emerging from that point. And this is a picture of the spur formation. Spur formation seen anteriorly does not cause much of a problem. It does not produce much of symptomatology. But spur formation, when posterior, will impinge upon the nerve roots. It is the impingement upon the nerve roots which causes the clinical manifestation so common in cervical spondylosis. Coming to the causes of cervical spondylosis. The causes of cervical spondylosis can be grouped entirely into two different compartments, the Sannikrishna Nidana and the Viprakrishna Nidana. Sannikrishna Nidana may be a recent injury, like for example deceleration injury, that is whiplash injury also we can call. Then exposure to cold wind. Exposure to cold wind means it is as simple as that. Exposure to cold wind and severe pain. See, pain is caused by vata. Vata is like an animal. When it is your pet, it obeys you. It always licks you. It always helps you. But when it is agitated, it is like a rampant animal. It attacks you with pain, stiffness, etc. So, exposure to cold wind, such a simple thing as exposure to cold wind will provoke the symptomatology of the cervical spondylosis if it is there with you. Then so many inflammatory causes, all these are immediate causes. Then the distant causes, like we call it Viprakrishna Nidana, may be work related, genetically mediated. Why in some particular individuals cervical spondylosis occur, and why in some other individuals who are going through the same work, the same lifestyle of the others does not get cervical spondylosis? Is it because of the exercise? No, not at all. Is it because of the living conditions? Not at all. Is it because of the writing habits? Not at all. Is it because of the load you wear on your head? Not at all. Then why? Because of the genetic mediation. And because of the genetic mediation means it's very difficult to treat such conditions. Asadhyaneva makhyada sarve rogakulo bhava. It's not very easy to manage it. Then prior injury like whiplash injury, which I have already pointed out. Then the biomechanics and the march of events in cervical spondylosis. Age lessens the ability of the nucleus pulposus to bear compressive loads. When you are a child, when you are a teenager or in your younger age, you can bear some weights. But as age advances, you find it difficult to bear that much load. The load transfer then shifts from the muscles to the annulus. Usually it is the muscles and it is the tendons, mind you, and the ligaments which bear the weight. But now, as age advances, as your muscles become weak, your tendons and ligaments become weak, the load is shifted to the annulus. And this results in fatigue failure, fissuring and rupture and herniation of the pulposus, which has been rightly pointed out by the earlier speaker. The load transfer at the periphery of the vertebral end plates gradually produces osteophytes and then gradually spondylosis. So this is a road from normalcy to cervical spondylosis to the osteophytic end. Additional stresses to posterior ligaments gradually occur, which causes facet arthrosis and hypertrophy, then thickening and buckling of the ligamentum flavor. What exactly is cervical spondylosis? As already pointed out by the earlier speaker, I too consider it as a Sandhigata vata. Because all the degenerative arthropathies, whether it occurs as an osteoarthrosis of the knee or the lumbar spondylosis, anything can be degenerative arthropathy. And this cervical spondylosis also is part and parcel of a complicated condition which we call Sandhigata vata. It is spinal and it is of the cervical spine, and here the lower cervical vertebrae will be more affected than the upper ones. The spinal canal in the cervical spine contains the spinal cord and not the cauda equina as in lumbar spine. This is a complication with cervical spondylosis. In cervical canal, there is very little space. With the amount of little space it can hold, if some problems occur, like for example the disc herniation, etc., the patient may go into a state of total paralysis. I have treated a case of total paralysis simply because of the cervical spondylosis. See, such conditions are amenable to treatment also by Ayurveda. But you should understand the condition, that's all. Even minor reduction in canal space may lead to compression of the spinal cord, producing devastating neurologic effects. And here, the importance is that the bony and muscular architecture of the neck constitute the spine of your region. It's not the bones alone which constitute the spine, which gradually turns into cervical spondylosis. It is multiple bones as well as the musculature of that area which constitute cervical spondylosis. These which are supported by the ligaments and disc, which differ from the joints or the extremities, and more bones than in the lumbar region. In the lumbar region, they have got only 5 vertebrae, whereas in the cervical region, they have got 7 vertebrae. And these bones are less stronger than the lumbar region also. In cervical spondylosis, the bone is subjected to, as elsewhere, it is subjected to osteoporosis, spur formation. Spur formation means various types of spur formations may be there, wedging may be there, beaking may be there, and reduced spaces in between the vertebrae with reduced height of the vertebrae also. The discs are gradually dehydrated and the loss of height also occurs to the disc. The tendons may be occasionally spastic. The nerves are subjected to pressure effects. The vessels are subjected to arteriosclerosis. Arteriosclerosis, the sclerosis inside the media of the vessels. Inside the vessel, inside the intima, you have got atherosclerosis, whereas the media is subjected to arteriosclerosis. Then I got a hypothetical suggestion that it may be due to the lessened blood supply to the vertebral bodies due to changes in microvascular bed, which also is a contributing factor to the cervical spondylosis. So collectively I will tell you that it is the changes in and around the vertebrae which is causing the problem of cervical spondylosis. And hence the condition can be composite in nature. Sandhi is the resultant area. It is only the resultant area. It is the end area of a pathological chain of events of the components. Like for example, take the case of a machine. A machine, only one component may be wrong initially, but gradually as it is working, the other components also, because of the one wrong component, all the other components will also go wrong. Likewise, if the muscle is bad, your bones will also be bad. If the bones are bad, the muscles will also be bad. The ligaments also will be bad. And the disc, maybe initially the disc may be the center of the problem. It will gradually migrate to such an extent that the whole area will be damaged. Sira, Dhamani, Snayu, Mamsa, Asti, Majja, all are involved, and the changes are reciprocal also. One change occurring to one joint means, one area means the changes are reciprocal to the other areas also. Such conditions usually start from the soft tissue. Bone changes may be the end result of it. Where does it all begin, the degenerative changes? Changes may begin in tendons and ligaments, which causes changes in bone, and vice versa also. These changes are part of a vicious cycle. So we have to break the vicious cycle. That's what our treatment aims. Because many a time we are not managing the bones. While doing Sneha Soda, etc., we are managing the muscles. I am not talking about the internal medicines, of which I will talk later onwards. And I am not encroaching upon the area of Dr. Sreekumar, who has to speak about the management aspects. But the pathological events are such that it is part of a vicious cycle. This is how exercises benefit. Suppose in a degenerated bone condition like cervical spondylosis, how is the exercise is working? How is the physiotherapy working? Everybody are telling that you go to physiotherapy, you will get substantial life. How you are getting result after physiotherapy? In physiotherapy, we are not doing anything to the bone. We are giving exercise to the muscles. We are giving blood supply to the muscles only, not to the bones directly. We are indirectly strengthening the muscles, strengthening the ligaments, and strengthening the soft tissue component of it. Likewise, when the muscles and tendons are strengthened, the strength also is imparted to the bone, and the load bearing will eventually be on the muscles, so that the bone is not that much affected, so that it is getting comparatively good relief. Degeneration, hence, is not to the bone alone. The paraspinal muscles and ligaments and the vital structures of the posterior aspect of the neck are also degenerated. Now, let's talk it all together in a different perspective. In the perspective of inflammation, ama. in the perspective of inflammation and in the perspective of degeneration. I'll tell you that both inflammation and degeneration are mutually reciprocal and mutually dependent also. When you are treating AMA, gradually the chances for degeneration will be less. When you are treating degeneration, gradually, but you should treat AMA first of all. But when you manage degeneration, after you treat AMA, then gradually the chances of AMA also will become reduced. So I am telling you that the inflammatory component and the degenerative component, two components are there in the making of conditions, not only like cervical spondylosis, there are so many other conditions like that. You have to treat AMA first of all, and you have to manage degeneration last of all. I'll tell you one point. Suppose somebody is coming to us with cervical spondylosis. Which would be the medicine that you would give first of all? I have seen many persons prescribing Prasarini Kashaya. For example, Prasarini Masha Belarasana Rasnaushade Prakotidan Kadampa, Pibandi Shirabujojayandi, Marudligarana Rahamta. All the medicines, most of the medicines, like Prasarini, Masha, then Kshira, etc., increases AMA because it has got Gurutva. It increases AMA. How will it affect? If in a given condition of cervical spondylosis who comes to you with pain and all, if you are giving Prasarini Kashaya, I think probably you may land up in trouble. At least the condition would not be amenable. You have to give medicines which annihilates AMA first. Like for example, Rasana Saptaga Kotha. Rasana Saptaga Kotha with ginger powder. That's what I am doing, because I am always after avastha, not the disease. Let any disease come to us. We have to treat, first we have to remove that amavastha. Then only we should treat the degenerative aspect. Otherwise, you may not get substantially good relief. I will come to that point later onwards in the course of my talk. Then there are the systemic components. As I already told, cervical spondylosis is not a local problem. It has to be considered as a local problem with a generalized perspective. It may also be the local manifestation of a general condition, like for example rheumatoid arthritis or the generalized reduction on bone density which is frequently seen in menarche in women. Due to the hormonal changes, women will have, due to the reduced estrogen, women will have bony changes, erosive bony changes like osteoporosis, etc. So at that time also, such conditions may also lead to cervical or lumbar spondylosis, osteoporosis of the knee, etc., etc. Fluid depletion is prominent in degeneration, whereas fluid retention is common in inflammation. In inflammation, you have to remove the fluid retention, whereas in degeneration, you have to additionally support that part with snigdhara. This is where the treatment modality differs. We have heard about the saying, water everywhere, not a drop to drink. Here, water is everywhere in amavastha, but not to the use of the individual. Kleda plus Ushna Swabhava results in Ulklesha, we all know. And in a humid place like Kerala, it is more rampant. When you go to Hyderabad, even in Coimbatore, I think, cervical spondylosis may not be that prevalent as in Kerala, as in places near the seashore. Cervical spondylosis may be there, the symptomatology may not be that much prominent, because in places where ultracha is more, humid conditions are more, it will create more pain. This moisture is trapped into the tissues. Thus, if it is this moisture, if not let out, is stagnated, and this causes much of the localization of the illness. We call it Srodorotha. We can also call, by the word Sushrava, we can call it Sthana Samshraya. And if a prior history of trauma is there, definitely that will cause problems. Humidity should be considered in a local scenario. Moisture is fluid plus heat. Moisture is nothing but fluid and heat. In a cellular environment, the heat increases pain. The cold increases stagnation, spasm and stiffness. So both cold and heat are making problems. In a condition where moisture is there, heat and cold together causes problems. That is why in some conditions where we apply heat, the condition worsens only. It is, see, suppose we are traveling in a bus or a train and we are get plenty of, we are exposed to cold wind, severe pain will be there. And then, what's the management protocol according to Ayurveda? We have to apply heat. When you are applying heat, what happens? Again the condition aggravates in some cases. This is because of the moisture entrapment. This is because of Amavastha, which we call Amavastha. In Kaphasthana, that is the cervical region, is a Kaphasthana, stiffness will be more pronounced than in the lumbar region where it is Vatasthana, and pain will be more in the lumbar region and stiffness will be more in the Kaphasthana. Prolonged stiffness may herald adhesions like encapsulitis as has been mentioned by my previous speaker. Prolonged stiffness may herald adhesions. This occurs not only in PA shoulder etc., but it occurs also in the cervical spondylosis. The transit of doshas. We all know in Ashtanga Hridaya Sutrasthana, the transit of doshas is mentioned. Vyayama, Dushmana, Staishnyad, Ahida, Ajaranarabi. All these are important. All these points are important in the making of cervical spondylosis also. Vyayama. Here Vyayama does not mean exercise. It means exertion. Vyayama, Ushmanaha, Taishnyad, Ahida, Ajaranarabi, Koshtal Chakasti Marmani, Dridatwad Maridashya Doshayandi. This is the transit of doshas which occur into the making of any disease. And here it can also be considered as a Vairuddhya, Viruddha. Yal Kinjil Doshamul Kleshya na hared tal Viruddham. It provokes the doshas, but it is not competent enough to relieve the doshas. This also cause Viruddham. Viruddham, mind you, is not a problem with the food only. We all think Viruddha in the concept of, in the context of food only, but Viruddha can also occur in the context of climatic changes, etc. The anatomical reasons of cervical spondylosis. I have already told that you all know that the vertebra is thinner at the cervical region than at the thoracic region, or still thinner than at the lumbar region. And we have got a normal lordosis. It is this normal lordosis of the cervical spine by which you are competent enough to stand erect, to hold our head erect. It adjusts the body balance end of the head with the body. The contour of the cervical lordosis is altered by sudden severe trauma. Sudden severe trauma as a hit on the head, as in whiplash injury, etc. It alters your normal body, normal head balance. More mobile parts are prone for degeneration when mobility is not exercised. To that point I will come. Why is thoracic spondylosis uncommon? We are all speaking about cervical spondylosis and lumbar spondylosis. Why not thoracic spondylosis? Have you ever heard of thoracic spondylosis? The problem is very uncommon. Why? Because the discs are attached. The discs elsewhere in the cervical spine, etc., are attached to the anterior and posterior longitudinal ligaments, whereas at the thoracic region, these are additionally tied laterally to the heads of the ribs by intra-articular ligaments, so that there is not much chance to move. Only the bending is possible there. Not like the cervical spine where we can do a lot of things, and in the lumbar region also where the mobility is more than in the thoracic region. Thus, the decreased mobility, the restricted mobility is there at the thoracic spine, and hence it is less prone for spondylotic changes. Then coming to the classics, because I have to speak about the Ayurvedic aspects. Kurchaha. I think you all have heard you all know what is meant by Kurcha. Mahatyo, Mamsarejju, well, Chatasraha. It is like a cord, it is like a muscular cord, Kurcha. Prushtamsham Ubhayadaha, Peshi Nibandhanartham, Dve Bhakye, Dve Abhyandare. Kurchaha, Prishtavansham, Ubhayadaha. Ubhayadaha may be laterally or may be anteriorly and posteriorly. Prishtavansham Ubhayadaha, Peshi Nibandhanartham, Dve Bhakye, Abhyandare Chadve, mentioned by Sushruta. And coming to the ligamentum nuchae. You all know what is meant by the ligamentum nuchae. What is ligamentum nuchae? Ligamentum nuchae is attached to throughout the cervical spine, starting right from the occipital bone to the C7 vertebra. In cats you have seen, how will you catch hold of the cats by this region? No? You are picking up the cats like this. There is a ligamentum nuchae in cats, and in lower vertebrae, these are in quadrupeds, these are just allowable to move the head like this. But in man, we are competent enough to move the head like this, because we are always in this posture, and the cervical region is at a lordosis, as I have already told. Then, in the previous slide, I told you about the Prishtavansham Ubhayada Peshi Nibandhanartham Dve Bhakye Abhyandarecha Dve. You can see the longitudinal ligaments, anterior longitudinal ligaments, as well as the posterior longitudinal ligaments, which go into the making of the spine and restricted movements of the spine. Partially restricted movements. You can move the spine, but not to that extent. If after a sudden injury, what will happen at the lumbar spine, for example, that one vertebra will override the other vertebra. This overriding of the vertebra is usually prevented by means of the anterior and the posterior longitudinal ligaments. The ligamentum nuchae is a representative of a complex ligament in quadrupeds, aiding in the suspension of the head and controlling its flexion, whereas in man, it helps us to hold the head erect. The other aspects of disc prolapse I am not mentioning, because my previous speaker has given a thorough explanation of it. Intervertebral disc and vertebral end plate also, he has given in much details, he has gone, so that I am in no way, I think I need not go into the details of it. Here comes the exiting and traversing nerve roots. There is an upper root and there is a lower root. The upper root is the exiting root at this level. The battery has gone, I think. Okay. The upper root is the exiting root at this level, and the lower root is the traversing root here, which becomes the exiting root below. So it is like this, it is placed like this. So any injury or any degenerative change is competent enough to press upon the nerve roots and then cause symptoms accordingly. Then coming to Ayurvedic perspective, what type of joint it is? In Ayurveda it is mentioned that there are 8 types of joints. Ta ede sandhayo ashtavitha, kora ulukhala samudga pratara, tunna sevini, etc. etc. Then greva prishtam vamshayoho pratara. What is meant by prataram? What exactly is word meaning of prataram? Prataram. Praharshena taranam means it goes like this continuously. Taranam, from one joint to another, it goes like this. From one bone to the another bone, it traverses. This traversal is called as prataram. Delhana has given an important definition for pratara. Prataratya anenadi prataro phelataha tad agradayaha pratara. Helps to traverse from one bone to another bone. And the importance of snayu in traumatology. This is a wonderful statement given by Suchrava long back. Long back means in the 4th century BC, you have to be beware of. 4th century BC, he has given a thorough explanation of snayu and its importance in traumatology. Evameva sharire asmin yavantaha sandhaya smura snayubhur bahubhur baddha stena bhar sahanara. It is the snayu which helps us to load the weight. Na hyastini, na vapeshyo, na sira, na cha sandhaya. These are relatively unimportant. Even bones are also relatively unimportant in the context of snayus. Na hyastini, na vapeshyo, na sira, na cha sandhayaha. Vyavadidas tatha hyandur yatha snayu sharirinam. When an injury, an assault, a trauma occurs to the snayu, it affects in more complications than in the case of bones, etc. A fracture is relatively unimportant than a soft tissue injury. In soft tissue injury, it is very difficult to heal a soft tissue injury, whereas it is relatively, we can efficiently manage a bone injury. So this point is more important in the context of spondylosis. And what is Snayu? We generally teach in undergraduate classes at the first year when dealing with anatomy, we speak that Snayu is tendon or ligaments. But when we come to the final year in Shalya, we speak that Snayu is nerve. Taking into consideration the various aspects that go into the making of Snayu or tendon or ligament, whatever it be, we have got only 7 dhadus. It is the 7 dhadus which contribute to the whole of our body, whether it is Snayu or Mamsapeshi, etc. But here, so I am telling you that Snayu may be ligaments or nerves. And where from Snayu has originated? Riktam, Mamsam, Medas, Asti, Majja and Shukram. Medasaha Snayu Sambhavaha. That is the mention. Medasaha Sukshma Snayu Poshanam is mentioned by Chakravarni. So it arises from Medas. I am going to the treatment aspects. Suppose something happened to the Snayu. How can we manage Snayu? For that we have to understand what exactly is Snayu. Whether it is ligament or whether it is nerve, Medasaha Sukshma Snayu Poshanam. It is from the Medas that Sukshma Snayu are being the blood supply and other supplies, the nutritional aspects of the Snayu is from the Medas. Snayu gives strength to the body and even bones are supported by Snayus. At the same time, muscles are the strength providers. Sirasnayu asti parvani santayascha sharirinam peshibe samardhanyasta balavanti bhavantyataha. Without muscles, you cannot get the strength. And without Snayu, if Snayu is injured, that creates more complications than the siras or muscles or even the bones. And coming to the Asti Dhadu, Tatra Asti Vahanam Sakalanam eva Medo Molam. We know that Dhatu Poshana by various Dhatu Poshana Nyayas, that Rasad Raktam, Tado Mamsam, Medas, like that if you go, the Asti is nourished from Medas. And from Asti, the Majja is nourished. So, Tatra Asti Vahanam Sakalanam eva Medo Molam. Asti Vahanam Srodasam Medo Molam Jakhanamscha. Medasaha Snayu Sambhava. Ashtangardaya Sharira. The tendon pain which people experience while fasting to reduce obesity may also be explained by this quotation. See, suppose we are very fatty and we are not taking any food. After some days, what will happen? The medas will be depleted in our body. And we will be getting severe pain in the body. Why? Because the nourishment is not proper. And the nourishment of medas is not proper. Srotodoshti. Let us come to Srotodoshti. Ulpeshad, Abhishyandad, Abhikhadad, Prapedanad. These 4 are collective features. Ulpeshad, Abhishyandad. Abhishyandad means inflammatory. Then Abhikhadad, traumatic. Prapedanad, that also traumatic. Majjavahini Dushyandi. This is exactly what is happening in cervical spondylosis. Ulpesha will be there, Abhishyanda will be there, Abhikhada will be there. In majority of the instances, Majjavahini Dushyandi, Viruddhanam cha Sevanad. So together these are the causative factors of a condition like cervical spondylosis. And in Charaka itself it is mentioned Vyayamad, Adhisamkshobhad, Asthanam, Adhivikhattanad. What do you mean by Vikhattanam? When after spur formation, the bones come to proximity. The discs are narrowed in height. So there is a tendency of the bones to make crepitus in between. So that is mentioned by Charaka as Adhivikhattanad, Astivahini Dushyandi. So collectively it is a problem of Majjavahi Srotodushti as well as Astivaha Srotodushti. Ulpeshad, Abhishyandad, Abhikhadad, Pravedanad. Majjavahini Dushyandi, Vyayamad, Adhisamkshobhad, Asthanam, Adhivikhattanad, Astivahini Dushyandi. So this is a collective, taking into collective perspective, this can be applied directly to the cervical spondylosis. And Majja Kshay Lakshanas. Majyakshaye Alpashukrada Parvabedo, Asti Nistodo, Asti Shunyadacha. Asti Shunyada can be directly correlated to osteoporosis, and Asti Nistoda can be attributed to the severe pain which we experience in cervical spondylosis as far as Ayurvedic perspective goes. Shiryanda Ivacha Asthini, Durbalani Lekunicha, Pratadam Vadarogini. What happens? People will ask, what is my condition, sir? Those people are telling that I am having cervical spondylosis. Please tell what my condition is. The type of Vadaroga will tell. The type of Vadaroga means Pratatam Vadarogini. It's a continuous feature, it's a chronic feature. Pratatam Vadarogini. Shiryanda Ivacha Asthini, Durbalani Lekunicha, Pratatam Vadarogini, Shine Majjani Dehinam. Then Asti Sadhu Dushti Lakshanas. Asti Adhyasti. What is meant by Adhyasti? Have you seen Adhyasti anywhere in clinical practice? What I am doing, according to my opinion, this performation itself can be contributed to Adhyasti. It is not Adhyasti does not mean that something is added here. Something which is here itself, it is depleted and it is changing shape so that we can consider the condition as Adhyasti. Adhyasti dandasti bhedashulam varnada. Keshalamana doshascha asti pradoshaja. Then Sandhi Vishlesha. Sandhi Vishlesha, laxity of joints. That also can be contributed to Sandhi Vishlesha, Atyanta Vardhayana Vikhattanam. All this you can see in the pathological picture is ditto in cervical spondylosis. Sandhi Vishlesha will be there. The structural integrity of the cervical spine is reduced. Sandhi Vishlesha will be there. Atyanta Vruddhayana Vikhattanam. Gradually, as days progress, there is a chance for Vikhattana also. Vikhattana means, as I have already told you, the proximity of the bones with each other will be increased and crepitus will be produced. Sankhattanam. Santyasthanor Bhavadi. That is the Dalhana commentary. Sankhattanam. Sankhattanam means close contact with both the joints. Santyasthano, Sandhi Asthanoho Bhavadi. Asthini Astitodaha is mentioned by Ashtanga Vagbara. So, we have been going through Sandhi, Asti Kshaya Lakshanas and Asti Vruddhi Lakshanas. What exactly happening in cervical spondylosis? Is it Asti Kshaya or Asti Vruddhi? Erosion can be adjusted with Kshaya, whereas spur formation can be adjusted with Vruddhi. So, cervical spondylosis is a condition where erosion is there, at the same time spur formation is also there. So, can it be Asti Kshaya or Asti Vruddhi? Osteophytes will be there, which is brittle in nature, and the normal integrity of the bone will not be there, shapelessness will be there. Hence, in cervical spondylosis, both happen simultaneously. It is a condition of Asti Vruddhi as well as Asti Kshaya. Asti Kshaya leading to Asti Vruddhi. So, both the conditions are there in cervical spondylosis. I am not telling that it is a condition of Asti Kshaya alone. And when the management is spoken of by Vagbara, there also it is the Dushti which is managed. It is not the Kshaya or Vruddhi which is managed. I will come to that point. Hence, however, the Vruddhi is at the wrong place and hence not beneficial to us. Vruddhi which is at the wrong place is not beneficial to us. It will contribute to the same symptomatology as Kshaya. And coming to cervical spondylosis in a local perspective, part of a general perspective, part of a cause of disease like Amavada, Sandhivada, Vadarekta, etc. Amavada is there. When Amavada affects cervical spine, the same symptomatology of and the same management protocol have to be followed in Amavada, which occurs at the cervical spine. It occurs elsewhere also. These conditions may occur locally also. The Purvarupa like Shledhangada, Sada, etc. in systemic conditions like Vadarekta, also periodic pain of shifting nature, Kutva Bhuta Pranashandi Muhura Avarbhavanticha, that also is mentioned in Vadarekta. That also occurs here. Bhutva Bhutva Pranashandi Muhura Avarbhavanticha. It is a chronic condition. Locally, pain, stiffness, swelling, loss of function, dizziness on moment, etc. Dizziness on moment may be due to cervical vertebral artery compression syndrome. That also may occur here. Coming to the Purvarupa, Rupa and Rupadrava. Presentation at the time of, I have to tell you one more thing. A patient is coming to you, he will be projecting some symptomatology. What is this symptomatology? What is this collection of symptomatology? Can be called See, doctor, I am having severe pain in the neck. I think it is radiating to the hands, and the medial aspect there is numbness and tingling sensation and maybe burning sensation, etc. These are what the patient is presenting to you. What is the Purvariva? How can you assess the Purvariva? Can the Purvariva be should the Purvariva be taken from the text, or can you make out your own Purvariva according to the patient, according to the individual? To the best of my knowledge, in this perspective of cervical spondylosis at least, I am telling you that the presentation at the time of the first consultation may be taken as Lakshana, and those before that as Purvariva, and the complications which may arise afterwards can be taken as Upadrava. In the context of general practice only I am telling you, not for writing the examination. Cervical spondylosis is a degenerative condition in the wrong place. Is a degenerative condition at Kaphasthana. It is a disease which is predominantly Vadiga type. When the spondylosis alone is taken into consideration and spondylitic element is forgotten, it is a condition at the wrong place. Because this is a Kaphasthana. As far as we are concerned, this is a Kaphasthana. Here Kaphaja symptoms may predominate, and grading of intensity and presentations determine the amount of ama that is going on there. And when ama stage has passed, there is the Lakshana of Niramo, Vishadoruksho, Nirvabantho, Alpavedana. Then that pain will not be there. So pain can only be correlated with ama-avastha, not a degeneration. Many of the patients with cervical spondylosis does not know that cervical spondylosis is there, because pain is not there. I myself had an example. I am not having cervical spondylosis right now, but some 6 years ago, one curious thing had happened. When I was going to bed, no problem was there, no symptomatology was there. I just went to bed, and around at 12 o'clock or 1 o'clock, I felt severe pain at the posterior thorax. Severe pain that I found myself very difficult to move. Literally to turn around also I couldn't. I was just stagnated. I couldn't move a little even. In the morning I had to be taken to hospital. Even in a car, when I was in bumpy road, I was getting excruciating pain, severe pain. But I thought that something was bad, some cancer or something like that is there. Being a doctor and a practitioner for over more than 15 years at that time also, I thought that I was having some serious problem, either pancreatitis. I was thinking about the anatomy which I had learned in those previous era. Maybe pancreatitis or maybe something there in the, is it in the abdomen or is it in the back? I don't know. I couldn't just spot it out. And those people did ultrasonography, and when the transducer was passing through my abdomen, I had got severe pain. And next I was, an X-ray of the chest was taken, absolutely normal, there is no problem. And afterwards I told them that you better take a CT scan of my whole spine, whatever it be, because I want to diagnose the condition. They took a CT scan and found that everything was normal. But I had severe pain. As is usual, they gave some anti-inflammatory drugs, and after 2-3 days I was okay. But I was not okay in the mind, because I thought that how and what produces this severe pain. I want to find it out. I was switching on from doctors to doctors, and they told that okay, you may take an MRI or you may take some other investigation, iodine injected investigation of bone scan like that, etc. I went through all these tests and found that everything was normal. Then I consulted another doctor, and he told that, doctor, why do you go from doctor to doctor, and you yourself is a doctor of some 15 to 20 years standing in the field. Why do you go from doctor to doctor? Why don't you take a mirror and look at yourselves? See, doctor, I have been subjected to CT and MRI, and everything is normal there, but why I got that severe pain? And he told me one curious thing, that if you take an MRI free of charge to some 10 persons right from the crowd, you take an MRI, after some 40 years or 45 years, some problem will be there. Somebody will have some problem. It does not necessarily mean that those people are symptomatic. Even asymptomatic people will have got a cervical spondylosis or a lumbar spondylosis or an IVDP for that matter. Why do you bother? Because of your lifestyle, and because of the lifestyle of so many people around, they might have got some serious problem. They might have got inflammatory changes or changes of degeneration. Only when in the inflammatory change you will have that much pain. In the degenerative phase, you will be okay. You will be doing your work, you will be feeling absolutely normal. So why do you go after all these things? He told me, and I thought that was an eye-opener to me. And that was an eye-opener to me, not only for myself concerned, to my patients also. And thereafter, when I judge every patient, thereafter only, I gave that much importance to the Amavastha. I was having some Amavastha, the next day or the next day it passed away. Now, even after all these years, I am perfectly normal. See, that is to be considered in this perspective also, I think. In Kerala, we are having a saying, whatever disease it be, we attribute it to Thalanira. What is this Thalanira? Doctor, I am having severe pain here. That is due to Thalanira. I am severe pain at the knees. Thalanira. What is this Thalanira? In females, we are frequently seeing that many of the cases would have this type of pain, localized pain for some days, and then it passes off. See, suppose somebody is having pain in the vertex, will pass to the cervical spine, will pass to the shoulders, back, hips, limbs, like that it goes down. And after a period of time, some 15 days or again later, it will again precipitate on the head, severe pain. Why? This is in a chronological fashion, goes from the head down and again coming, and I thought that, okay, it may be linked to the hormonal climate of the body, maybe due to estrogen differential. But what in the case of men? Even males are also affected like that. So what is this Thalanira? So this is a concept which need further evaluation, I think. And now I think that it may be due to the influence of heat on Tarpaka Kapha, which is mentioned by us in our science. The management may be Stambhana. That is where the importance of Takradhara comes. In many of the patients who are subjected to Takradhara, this complaint of Thalanira were reduced to a certain extent. Stambhana procedures, Takra or Tailadhara, Talam, Talapolichil, etc. may be done in such cases. Then trauma and cervical spondylosis. Vadhara has mentioned an important statement in the management, in the context of fractures, I think, about Chatoshma. What is the role of Murvenna? In our science, Murvenna is not mentioned. It is mentioned in auxiliary sciences, Murvenna. We are using Murvenna with good results. But if you manage Vadaroga with Murvenna, you will not be having any, you will not be getting any results. It is part of traumatology. In traumatology, what we are intended to do? Some serious injury, maybe soft tissue injury itself. After soft tissue injury, what has to be done immediately and what has to be done after a period of time? Immediately, yesterday or day before yesterday, if a trauma was there, we can apply Murvenna and we can bandage it with Murvenna. But after 7 days or after 8 days or so, if you are managing it with Murvenna, we are not getting any relief. I was wondering why it is like that. I remembered Sushruda's statement of Sadhya and Dushta. Any injury, whether there is a Varna outside or not, can be considered as Sadhya. And after a period of time, if you are managing it or not, after a period of time, it turns to Dushta. And in the period of Sadhya, it has to be managed with Shida drugs, because Vakra has stated about Chatoshma, the inflammatory pain, which is just after the